Okay, hello everybody. How's it going? Just wait for people to join in. So I'm just setting up the call right now. We will be hosting on the Facebook live feed the 3:00 call that the mayors and chiefs have been having every day at 3. And then there's oh, my finger. I hurt my finger. And then there's the Saskatchewan Health Authority that also joins most days. And I have a special guest today who's also going to tell us a little bit about some of the work that he's been doing with MBC. So here we go. Brandon White.
Hi, everyone.
What's up, Brandon? How are you doing in L'Orange?
I'm doing well, just hunkered down at home, do most of my reporting and work from my home. So good.
So do you want to just tell people a little bit about what you're doing with MBC?
Sure, yeah, I was just trying to find my my document here. So for this year, I started working with MBC Radio here in L'Orange, and I did so via a Government of Canada injection into the Department of Heritage to create local journalists. So there's been a progression throughout the last couple of years where institutionalized journalism has become progressively more partisan and more removed from people in these small communities. So as a recognition of that, I guess the Government of Canada wanted to get more local journalists. So they gave a bunch of money throughout Canada to create these local journalists, of which I was lucky enough to become one through MBC. Yeah, we were a radio station, but we previously did a lot of advocacy and journalism, so we wanted to get back into that. And I was an acquired hire through this federal grant, and the point of the grant is to hold the powers accountable, which sounds super lofty, I know, and really visionary, but really it's just about making sure that people, real people in our communities, have what they need, that their voices are heard, and that they have the same opportunity that any Canadian really should have. So it's about civics, and it's about making sure people are given that opportunity. So really quickly, some stuff I did in the past was working with the Lac Orange Indian Band to highlight their Wellness Treatment and Recovery Center. In January, I talked with Chris Morasti of Men of the North as soon as they came out and got the radar on that one. Talked to Gary Vidal, the Shadow Minister for Indigenous Services, Shadow Minister of the Minister of Indigenous Services. And lately I'm doing stuff on food security with Priscilla Satie, who has a David Suzuki grant for Northern Saskatchewan looking at trappers and hunters and how climate change affects that. I'm also got a video coming out with a Buddhist monk in Sri Lanka. That's going to be really fun. And I'm working with the Lac Orange Indian Band maybe to do a kind of a chiefs debate in the next coming week to try to get their platforms further out there. So my hands are in a few things. I like to just basically help citizens make sure that they have the voice they need. And yeah, if you find it difficult in any way to live your daily life or get the support or resources that you need, I'd love to hear from you. Does that work, Jordan?
That is great. So Brandon has he's joined a few of our meetings with the Northwest Communities Incident Command Center, and just kind of offered to share the stories of community members, some of our leaders. So yeah, it's a very cool resource and a really good initiative. I think that's super important, having our own people sharing our stories, because I think the way stories are told are also important, right? I don't know. I've been having some trouble with some of the stories that are coming out. Just like, it's not human, right? Like, we see like person died of COVID, and it's like, okay, that was a mother or an aunt or a cousin to somebody, like there's way that stories need to be told. And anyways.
And can you still hear me? Yeah.
Yeah.
Yeah. The second that something becomes a pandemic, then we get into the language of statistics and people become numbers. And I'm very much not about that. I want to access the human side of that. So I guess that, yeah, exactly.
Great. Do you have like a page that you want to share?
Can I do that? I've never used this platform before.
So I have you on Facebook here. If you just send me whatever link to whatever page you want me to share, I can do that.
Yeah, 2 links. I sent you 2 links. The first one is just my YouTube for the videos. So I'm a video journalist, I guess, under the grant. So all of my stuff that I create is generally in the video format, and it lives on YouTube. But as well, the grant does have a fancy new federal portal if anybody wants to poke around there. And that's just a bunch of basically all the journalists that are like myself under this federal grant throughout Canada put their stuff onto the second link, which is the federal portal. What you're seeing now is just my little channel on YouTube, which you can also put the videos there.
The other one is the community link that you sent.
Yeah, so this is just my the MBC video channel on YouTube, and then the other link is for the federal portal where all the local journalism initiatives that are doing video, like myself, upload their stuff from all over the country. And again, these are community journalists. They're at small institutions like MBC, when you're getting grassroots stories, not
Cool.
huge. Mm-hmm.
Love that. Okay, cool.
So anything that I do, the great thing about this program, this federal grant, is that anything that comes out of working with an LJI, like you said, an LJI is a local journalism initiative hire. So remember I talked about that grant through the federal government. That's creating LJIs like myself, like I'm a reporter through the LJI program. But the nice thing about that kind of coverage is you get a real person, a local person, a person that understands a bit of the locality and the culture. And then while getting that local coverage, it's also put onto this federal portal, so it can be picked up by other agencies and stuff. So it kind of local made national all at once.
Mm-hmm. Okay, very cool. Thanks for that quick spiel. I know I gave you like a tight little time limit there, so
that's all. This is how we work now. It's all good. Thank you for the opportunity.
Cool. Well, thank you so much, Brandon. That won't be the last you hear from him. You'll see some of his stories being shared on the 155. So thanks. And I'm going to call into this call now. So I will see you there.
Mm-hmm.
See ya.
Later.
All right. So I'm going to turn off the camera. Don't go anywhere because this is not over. We are going to join the leaders call now. And for the first 5 minutes, it'll just be people signing in. So you'll kind of get to see who is signing into the call. Some days there's 25 people, some days there's 40. So we will see. So please stay tuned and share this so that people can hear. There's a lot of really, really important information that's shared here. Sorry, I didn't even do a really good job at introducing myself, but I'm Jordan Burnoff. I've been kind of helping to build some of the content for social media, some of the website stuff, and helping with the communications piece. So that's why I'm here hosting this. But you won't see my face anymore. I will make the link public so that you can share it, and you can also comment, share any feedback, any of that kind of stuff. But yeah, just make sure, keep it respectful, keep it classy, folks. So thank you for joining us today, and yeah, please share this.
the 31st person to join the meeting.
Xavier, SHA.
Xavier from SHA.
Jerry Ledoux, HMP.
Jerry Ledoux from RCMP, thank you. Lawrence, are you on?
Melanie Obashan, Buffalo Narrows.
Melanie, thank you.
Hi, this is Dr. Zayed, the Medical Health Officer.
Thank you, Dr. Zayed. Rim, welcome back.
Thank you. And good afternoon, Rick. This is Dr. Kaketla here as well.
Dr. Kaketla, thank you.
Harold Johnson, Malinosa.
Harold, thank you very much. Those of you that are on the line, just to give you a heads up, we are being broadcast on Mississippi Broadcasting for the next 2 hours at 3 o'clock here, and it's live streaming on our 155 website and Facebook. Nobody has their.
Hi, Rick. It's Jason Young.
Jason, welcome back. Welcome, and welcome back, I should say. Thank you for joining us. We've had Maureen sit on us and report, so thank you for joining us.
Hello, Rick Clarence here.
Thank you, Clarence. Thank you. I don't know. I can't remember what it was. But water kept dripping from the. Okay, just mic protocol, guys. You mute your mic, and then we'll call you as you come. That way we don't have background noise.
Rick, did you got my name? It's Donna.
Donna, I got you now. Thank you.
Hi, Rick. It's Bob McGuire dialing in. Sorry I'm late.
No problem, Bob.
Hi, Rick. It's Jordan here. I didn't check in, but we are live streaming as of 5 minutes ago. So.
Jordan, thank you. We're just doing a roll call of all the people that are joining us. So Mississippi will be broadcasting live here in a very short time. We got Candace out of La Plonge, Clarence Pine House, X Métis Nation Region 3, Jennifer Hennique from the Saskatchewan Health Authority, Robert St. Pierre, Mayor of La Loche, Max Morin, Gabriel Dumont, Maureen from Northern Lights School Division, and I heard a Dean, but I wasn't sure what agency Dean was from.
Yeah, it's Cabrock with the RCMP in Green Lake.
Okay, thank you, Dean. And Martin Moore from Métis Nation and Buffalo Narrows, Métis Local. Yvonne from our tech team. We got James and Jerry from Beauval. Got Carol and Nat from our Incident Command. Kelly Kwan from Turner Lake. Carla Brohog from Minister of Justice. We have Arliss Culinaire from Canoe Lake. Xavier from Saskatchewan Health Authority, Barry Ledoux from RCMP, Melanie Obashan from Buffalo Narrows, Dr. Zayed, Medical Health Officer, Dr. Kaketla is Medical Health Officer, Harold Johnson from Malinosa, Jason Young, Director of Northern Lights School Division, Donna Janvier from St. George's Hill, Claude McGuire from Indigenous Services Canada, and Jordan Burnoff from our tech team here at 155. And okay, any other communities that may have this log on? We got your name and location.
Hi, Rick.
Dwayne from Arlacrosse, thank you.
And Nadine and
Ron Garden, Bush Narrows. Nadine and Ron, thank you. Francis Iron, Kennel Lake. Thank you, Chief Iron. Hey, Rick. Yes.
Rick, we got about 2 minutes here of this song. Play. If you just let me know when everybody has done roll call and you're ready to go.
Okay.
Okay?
No problem.
Okay, thank you.
Okay, there's a background noise coming from some microphone yet. That must have been Mississippi, maybe.
Leonard Mongrahan, Northern Region.
Leonard Mongrahan, thank you.
Andrew McClutchy from the FHA.
Andrew, welcome back. Okay, there's background noise. That must be just the new technology that we're using. So if we have a chance, all our leaders, that elected leaders, will put in the beginning for briefings before we get the community reports. This time we'll ask the chiefs and the Métis and Métis representatives, Métis leaders, and also the mayors if they want to address us before we go into community reports after the opening prayer. So at this time, if Mississippi, you're ready, we're good to go.
Are you ready to go live? I can fade down anytime you're ready.
Arliss, are you ready with the opening prayer? Okay. We are ready, Mississippi. You can put us on.
Sounds good. I'm fading down now. And you guys are live.
Thank you very much for all of Northern Saskatchewan that's listening to Mississippi Broadcasting and our streaming live. We welcome you. This is our Treaty 10 Pandemic Council. This is a planning council for dealing with COVID-19 in our Northwest communities. And we have been meeting here for the last almost a month and a half now. Since March 30th, we've been engaged with each other to try and face our COVID challenges that we're facing. At this time, we'll have an opening prayer. So I'd like to call on Arliss Cullinan of Canoe Lake to open the prayer.
Bonjour. For those who are with us, as well to the many people who have joined us from day one. There has been many years that have been together and doing community reports and working together. And every day we meet, we always have our open prayer to help guide us. And so at this time, I'm going to be doing 2 prayers today. One will be in Cree, and then a Hawaiian language, and then as well with an English prayer as well. And I think it's all is important to note that to have everybody that's online be listening out there on MBC, to all the family members. Again, we can't stress enough how important family is at this time, and that we are doing everything we can and possible to protect our families and our loved ones. Itsimanto, Pinanas Kumpinan, and Otspagisa, the women, Camille, Timan, Kisiak, Inan, Tastobi, Sarau, Inan, Inisil, and Ego, Pio Matsuin, Ipsef, Hi. They pray for the strength and courage. Life seems full of stress. Our busy homes, our hairy work during this COVID-19 time, sometimes we fear for ourselves, torn between one tension or another. At times we lose our nerve and we feel the need to get away. Help protect us, Creator. Shield us from the frailty of the spirits. Protect me from my own powerlessness. Free me from all anxieties and doubts. Give us the vigor to push on and continue with the mission you have chosen to task us with. Help us remember, Lord, that you are there beside us at all times. Or if I fall, you will be there to carry me through it all. So with that, I just wanted to again acknowledge all of those that are listening in MBC Radio Network and with our main group that are here, that we've been here from day one. I'd like to acknowledge all the Teteac, our elders that are listening. I'd like to acknowledge the leadership that is on, the chiefs and the mayors, and those that are from the Saskatchewan health officials. May the prayers and thoughts, be well received and to come with an open mind. We have a clear understanding of what is about to be said today and take those words with a good heart. Hi.
Thank you, Arliss. As we have gathered here, we're responding to a pandemic that has been declared by the World Health Organization on March 11th. And in declaring the pandemic, it is because of its human-to-human transmission as a COVID-19, as it's now being labeled. So this pandemic reached our shores, and as a response, on March 18th, our Saskatchewan government declared a provincial state of emergency. And since then, our schools and our normal way of life
Rick, you're not sounding.
There's some technical.
I think we've lost Rick. Sit tight. Don't go anywhere.
George Burnos.
Yep.
So do we?
I think that prayer was too powerful.
Well, I think what I'm going to do is this Arliss here again, just for everybody that's listening. I just want to make acknowledgement that this is yesterday was an acknowledgement sending out to the health nurses, the nurses in general, the providers, our frontline workers. That yesterday was a national day for appreciation of our nurses. So I just want to make acknowledgement on that. And while we're waiting for Rick, also acknowledge the fact that our pipes were lifted yesterday morning at 8 with the pipe carriers from Treaty 6 Adhesion, Treaty 8, and Treaty 10. And they were all synchronized so that our prayers can be answered and heard through the pipe, through the ceremony. With that, I just wanted to make acknowledgement of that.
Arliss.
I'm back.
Oh, there you are. I was just going to take over for you, Rick.
Thank you, Clarence. I don't know what happened.
Arliss came in and filled in the gap, but go ahead there, Rick.
Thank you, guys. I don't know where I got cut off, so I'll just repeat what I had said. On March 11th, the World Health Organization declares a pandemic worldwide. On March 18th, our Saskatchewan government declares a provincial state of emergency. On March 25th, an emergency act was created by the Government of Canada for international travelers. On March 28th, is when our joint leaders of Northern Saskatchewan responded to the pandemic response here by unifying our municipal mayors, our First Nations, and our Métis Nation leaders. All collectively wanted to work together on responding to the pandemic in our region. So COVID-19 was a major threat we saw in the news that was causing major troubles at the time in China, Italy, and then it moved to the United States and North America. So as it came to Northern Saskatchewan, we were looking at pandemic responses. And how we got involved in the pandemic planning process is our First Nations had pandemic plans prepared for SARS and H1N1, and they shared it with our Métis and municipal leaders. And that's how we figured out on what responses we need to do. For the initial communities of Pine House, Patronac, English River, Buffalo River, all wanted to have a lockdown situation. They started putting up checkpoints. That's to monitor people's movements and to mitigate the spread of this COVID. And we tried to figure out what to do, and one of our first responses was early identification, early isolation, and containment. And part of that containment is patient care. So we've realized that up to now, that all the tests are being provided for COVID. If you're found positive, you'll be sent home for family care and home care. You have to be careful on how you care those patients at home. You have to isolate them and practice the safety protocols of COVID-19. It's so easy to spread. It's so easy to infect. So that's when we started looking for PPE and protocols. And we relied on the World Health Organization for their technical guidelines. So we've been working towards this, and has led us to today. So we've had daily meetings from March 30th. We started our daily meetings at 3 o'clock. And this is one of the days that we do this. This is where we get community status reports, and we also want to find out how the medical health status of our region is. So we open our meetings with getting a report from our medical health officers, and I will call on Dr. Zayed and Dr. Kakatla as part of our medical health region to report to us.
Good afternoon, everyone. We will, as usual, we are coming back here to report the number of cases as of today. So we have 3 new positive cases today, with a grand total of 173 positive cases. And actually, the number is maybe a lot lower, but there are an explanation for that. When we have positive cases, there was a modification based on the reconciliation with NISA. So we have an auditing about the number of cases and if a person changed their address. And this is something that is happening with any other infectious diseases. So we might find the number of cases today broken by community is changes. But for La Roche, we have 147 with 3 new cases today, but there are some cases that have been with different addresses. So with our auditing, this is the total number. I will leave the cases for the other Western communities for Dr. Kakatla to report on.
Yeah, I can go ahead here, Reem. Thank you. For the other communities on the west side of Beauval, we have a total of 13. At Jans Bay, we have a total of 3. For Isla Cross, we have a total of 4. For Buffalo Narrows, we have a total of 6. And maybe I'll just make a comment on that additional one from Buffalo Narrows. It's in alignment with what my colleague, Dr. Syed, has just reported in terms of that one was tested, but we just received confirmation about it. So it's been added to our numbers for reporting, and that information was provided directly to the community as well.
In terms of our activities, so for the activity in La Loche, we started the mobile unit, mobile active case finding yesterday. So as you see, the number of cases is really decreasing. So at a certain time, I think around early weeks of May, we were getting like between 18 and 20 cases per day. Now we have been consistently having less number of cases, less number of positive cases per day, between 3 and 4. And I think there are many factors for that. First of all, our vigorous contact tracing was very successful. The second thing is the travel restrictions. So other than the vigorous contact tracing, the contact tracing will give us also an idea about where the cases are, what are the things that are happening. So we had the precautionary advisory that was that was issued by the Northern Medical Health Officer to that recommends the self-isolation for people coming from Fort McMurray or Northern Alberta, and that was helpful. The other thing, there is the travel restriction with the NAD travel restriction, the closure of the alcohol store, the establishment of the managed alcohol program, and in addition to that, we started the next phase of our vigorous contact tracing by acting on active case finding, and which is a door-to-door mobile campaign working with the community leadership in La Loche, and assessment of the houses, of the household, with a targeted testing strategy. And it is not only about testing, it's a risk assessment for all the kind of support that a household would need. And the testing strategy included two things. If there is assessment, the risk assessment, and if there is someone who has symptoms in the house, we test them with the point of care testing and test the rest of the household and then the test will go to Regina for confirmation in our provincial lab. So we go to door to door. There is also an assessment regarding any kind of risk factor. If there is some people in the house who is vulnerable illness, or if there is anyone who is having like other vulnerability that we can address from a health side or from a social side. And we work with our public health nursing in the community as their liaison person, and also with the EOC for every community. And with the COVID-19, we usually before we don't release the numbers broken down by community, but we started to release the number because we wanted to have this collaboration with the community through this platform of the Northwestern Community EOC and ICC. It was we find it very useful to discuss the challenges, discuss issues, and sometimes the discussion may be heated. Sometimes the discussion is like there are many questions that are raised, but in the end of the day, it is a great communication and a very good platform for communication. Thank you.
I'll just add a little bit before we hand it back to Rick and others around the table. Thank you for that additional context that you provided. One other thing that I know we've heard from people around the table here is information that has been requested related to the number of recoveries. So I'll just add that information as well. And it's good for people to know that we are continuing to see people recovering from COVID-19 in the north. So far, we have counted 37 recoveries in total, and we won't have time, I guess, to go into detail about that, but we're continuing to see recoveries, and we still have a couple of people in hospital, but for the most part, people have been able to isolate at home and manage symptoms that they're experiencing within their home communities. This has been a challenging time for all of our communities, and we're grateful for the opportunity that we've had as public health physicians responsible for looking out for the health of Northern Saskatchewan residents, to be able to work in partnership with all of you on this call and with those in the communities who are listening in. This COVID-19 pandemic has presented some challenges in that we don't have our usual go-tos for treatment in terms of direct medication for curing the disease, as well as the lack of a vaccine at present. So some of the tools that we have at our disposal are what Dr. Zayed has just articulated in terms of early diagnosis, isolation, contact tracing, and all of the other measures that all of you on this call have heard about, the frequent hand hygiene, ensuring that we're adhering to physical distancing measures, restriction of travel between households and between communities, all of which have shown evidence of success towards our efforts to contain the spread of disease within our communities. We know that we're not out of the woods yet. Dr. Zayed described the decreasing trend in terms of the number of new cases that we're identifying, but it is important, I think, for all of us to recognize that we're still vulnerable in terms of our communities in the north. We can potentially see outbreaks elsewhere. So in that context, we need to still remain vigilant and adhere to what is being advised from a public health perspective in order to prevent further spread of disease within our communities. And we hope that we're going to be able to continue together as we have so far in terms of reducing the impact of COVID-19 within our northern communities. I'll hand it back to you, Rick.
Thank you, Dr. Zayed and Dr. Kuchatla, and we look forward to working with you on a daily basis, and thank you for the work that you're doing for our patients and our community's preparedness. It's greatly appreciated. At this time, we had our opening prayer from Canoe Lake, so I'm going to ask Chief Francis and Arliss to do their community report.
Okay, I think I'm going to ask our chief to start us off, and then I'll do the community report that we have for Canoe Lake First Nation. No, I think Arliss, I'll let you do the report first, and then I just have just few comments that I want to address. Just in terms of the roadblock, really, that's where the big stumbling block is. So I'll let you go ahead and do the report, and then I'll probably be venting a little bit. So just for you to go ahead, Arliss, and then I'll go right after you.
So with that, I'd like to welcome to all of our visitors, all the guests that are with us this afternoon, and especially, again, with those that have been with us since day one. My prayers and thoughts go out to each and every one of your families. During yesterday's community report that I came in on the end, I just wanted to clarify the air that I was speaking up the few elders that had got turned away on the 165 highway. There was no ill will to our surrounding communities. If I came off on that subject, was again all innocent. So that being said, I just wanted to state that yesterday we had our pandemic committee meeting, and we had a lot of thoughts and a lot of processes. And I always ask the question, and I heard that with our pandemic committee yesterday, was always keep in mind when you're doing the option items part of our meeting,
keep in mind and ask that essential question: are we ready? Are we ready in 5 minutes? Are we ready in half an hour? Are we ready in an hour? Are we ready in a day? We don't know when this is going to happen. Fortunately, some communities have not had COVID-19 present. So that goes to show the resilience of our people and those that are in surrounding communities that do have some cases in their communities, that we're keeping the numbers low. And I wish that the people in the South would understand that it could have been worse. And our people need to be, again, commended for their vigilance. There are some that don't adhere or take that personal responsibility on. And, hopefully that those people, if they're listening this afternoon, please do it for the safety of you, yourself, and your family. Because at the end of the day, that's who we come home to. Those are the people we come back and we share our table with, when we eat in the evenings, when we sleep at night. And so with that being said, we keep that in mind. And with anything that we do as an education committee, we come up with recommendations and we do it as a guiding committee. We're not at all enforcement, so we don't get into that action. We're there to try and guide the community. We do it as a committee member. We run everything through each other. We have a teleconference line that we try, and when we can't make it into the meeting room itself, we try our best to connect through teleconference. And we're privileged to have Rick Liberty and MLPC Daryl Wright join us that day. So with that being said, there's a lot of things that have come up, and and on as much information by our leaders and especially our chief. We are very fortunate to have our chief and Councillor Bernie Siren as part of our pandemic committee. So a lot of times the things get passed. We come together and on a Friday and we try and come up with some recommendations for the Monday meetings that they try to have, right, whenever they can. So there were a couple of things that I wanted to ask some of the committee members brought up yesterday. So the first thing that I just wanted to ask of the communities out there is community construction guidelines. Here at Canoe Lake, we're going to have some major projects that need to happen sooner than later. So I'm asking if there's any communities out there that have created any kind of construction guidelines for their communities, and if so, who is willing to share? The second thing I wanted to bring up was we had a member on our committee that wanted to utilize the community food services and to check into that. So I'm asking Kelly to ask Rebecca Sylvester if she can get a hold of myself or somebody, or if I can do it through you, Kelly. As you had shared that with us last week or the week before as well. So I just wanted to, I think one of our committee members wants to try and reach out. We have our in-class production pretty much halted way back on March 13th or 16th. So with that being said, with the ministry's letter that come out on Friday stating that there'll be no more in-class instruction, that we'll be doing it from a virtual platform and put a snag hole in all the things that's happening at the school. So our suggestion for that, and this is just the idea that come up with one of our staff members, Acting Principal Geraldine brought up the thought of having a drive-through in the parking lot of our school with the stage that we use for our Christmas concerts, and they're safe at the diploma in that fashion. So that's just throwing that out there. And one more thing to report is we had True North make donations of backpacks for our students that had all the classroom instruction, all that stuff, in like the essential supplies that are needed. So that we're waiting for that to come in. To thank Gary Morin again for doing a due diligence and getting out an RV unit out to Eagles Lake That was very much needed. And again, I don't want to get into too much, but I do know that the sanitation supplies, the kits have arrived, and so I don't know when that's going to be taking place. So I'll leave that in Chief Francis' hands. So with that, I do my daily smudges, and this morning at the community fire that has been lit since day one, we made some prayers, some offerings for all of you today. So with that, I think leave it in our Chief Francis' hands.
Hey, good afternoon, everyone. First of all, I'd like to start by thanking Arliss for opening us up with a prayer. Always good to start this kind of process, especially during this difficult time with prayers and smudging for all our surrounding communities during this tough time. It's gotten recently tougher, with the roadblocks and whatnot. So I just want to acknowledge, I guess, all our northern communities for all the hard work that they're doing for each of their members. It's a tough job being in the front line, being in a leadership role. It's a very stressful time. I just got off a conference call before this one. I just kind of gave it to Minister Carr and as well as Marlo Pritchard, this kind of challenging them on these roadblocks. I guess that's kind of the frustrating time. What we're dealing with is defining essential, and then I just basically challenged them, and I said, "What you gonna do if all my people try to go shopping and I lead them? Are you gonna throw me in jail?" So pretty well that I'm frustrated with everything right now, and that's where I'm leaning towards. Is if it comes to making a scene like that, they've shown that they're deflecting our questions. They're deflecting everything that we ask, and we're not getting straight answers from them. We're told that this is the way it's going to be for a short amount of time, no timeline. We are, as each individual community, we are all improving. You can see in the numbers, the cases are declining all over, and they should at least acknowledge that and show that we're making that effort as well. I also pointed out that the differences that they did in the South, they did not close down the South when it came to something like this, and all of a sudden, I was straight out saying I'll get sick, and then they direct everything to close down, and I even told them, "Well, shut down our resources." Well, I just got so frustrated. I did, I kind of had some swear words in there, which I got to apologize to them for that. So, it's been just very frustrating time as a leader when you're trying to fight for your people, for everything, for basic essential needs that you can't get in certain areas. Our little stores can't pick up the slack. Now we know Val General doesn't have the proper stuff that we need, proper cleaning supplies, baby formulas, etc. It's just ongoing. Our major shopping center has been Meadow Lake for 30 years, and when you're talked down to from certain officers, and you're not treated with respect, just as hearing stories from my own band members, the way they're talking, and that's the problem. There's a problem there, and then if you're going to talk to my people like that, then there's a big problem, and then we have to deal with it as leadership to make sure our people are safe. So I just want to acknowledge everyone for, I hear the same frustrations around the table all the time, and a lot of it is with the CERM officers, the checkpoints, with everything going on right now. We did ask for assistance in this a while back, I remember, but they're not putting the trust in us as our own communities. We know our own people. We know who should be allowed in and out access, and just frustrating that the Sask government is not putting trust into the northern people. So as you can all hear, it's been a very tiring day today for me as a leader. I'm worn down today. I'm really tired, So I just want to just relay that message out there that you guys are all doing a great job. I acknowledge you guys all real well. Still going to be fighting a battle here for the next couple of days to make sure we have a shopping day that's supposed to be coming up for our people tomorrow that we allow once every 2 weeks, and they're not going to be allowed into Meadow Lake, and you know, that's the major shopping center, and my people are running scared right now. You know, they stocked up just for enough for 2 weeks supply, and you know, we give them that shopping day every 2 weeks to go restock. So it's a pretty tough time right now. So, but I'd like to thank you all again for taking the time to listen to my frustrations. Thank Arliss and our own pandemic team for all the hard work they do. Big acknowledgement to our own community members back in Kenno Lake for being very compliant and patient with us. It's been a tough road, 7 weeks. I think we've been at this, and our people have been very compliant and patient with leadership. So I thank all Kenno Lake membership for that, and thank you very much.
Thank you, Chief, and thank you, Arliss.
Brandon, if I could just make one comment.
Yeah, who is it?
It's Daryl with MLPC here. I was on that call as well, and I will say that I don't think your choice of words were uncalled for in terms of continually being told during meetings that start at 2 o'clock by 2:20 they have to leave is kind of insulting, maybe the first time, but you know, if it's reoccurring, it does show a certain sense of lack of willingness to sit down and talk. So just one of the things, though, is that, and this applies for Treaty First Nations, is that in the public health order, there is an exception for exercising treaty rights. And so when I went to La Plonge yesterday to do some drop-offs, I decided I'd test it out, and I pulled my treaty card out and went through the provincial stop. And so if you tell them that you're exercising your treaty rights and you need to go past to go hunting, they have to let you pass. So, you know, if you're going hunting at the Meadow Lake grocery store and get yourself a steak, that is what it is. I don't know what the consequences will be if you come back with grocery bags, but at least you can get through without getting arrested. So just some consideration there in terms of bringing the treaty card with you guys when you go through.
Thank you, Daryl. Okay, we'll go to Clarence out of Pine House.
Hey there, Rick, can you hear me?
Yeah, I can hear you.
All right, Rick. The last comment, just wanted to add to the last comment on the treaty right. You know, that is I talked about that yesterday, and it's a very unique option or opportunity for First Nations people to utilize their right to hunt. On the way back home, if you manage to pick up a truckload of groceries, I cannot imagine or even think of anything that can be done by law enforcement officers, CERM officers, to charge you for having groceries, because that would give them the authority to charge you for picking up gas on their way back home. That will give you authority to charge you for picking up a bag of chips while you're gassing your vehicle up. You having to detour somewhere to pick up some necessities shouldn't allow them to charge you for that. So I believe that is a very strong comment from my friend at the MLTC there. Having said that, our home back here is still at no cases at all. But I do want to bring up what's been going on, and I understand that the chief and others, mayors, have had a meeting with the Ministry of Government Relations. Now, we've had these meetings a day prior to May 6th, and the exact same thing happens. The northern communities, our dynamics, it's like we're at a festival or a gathering each and every day, because our propensity to visit each other, to share, we're always in contact with each other. So it's very different than the community dynamics in southern Saskatchewan, in Saskatoon. I've lived in Saskatoon. I didn't even know my neighbors left and right of me. those are the dynamics in southern cities. So they shouldn't apply the same principles, the same laws, the same orders on us in terms of how we're dealing with the COVID virus. They talk about consultation. You know, consultation is back and forth conversation and discussion for us to understand what the impacts are going to be on us while they're trying to impose health orders. We need to understand those. They didn't give us those opportunities on May 5th when they met with us. They said, here's your three options. You choose which option you want. We were forced to choose very rapidly on the spot. And as an aside, they said, we only have 30 minutes to talk with you guys. There is no process of consultation from the province of Saskatchewan, right? There's a high level of lack of understanding for the dynamics on how we operate on a daily basis in our community. So when the province tells us this is what we're offering you as a solution, and you give us three choices, but you only say you have 30 minutes to choose, that's not consultation. So when the order came out on May 6th, the public health order, Marlo Pritchard from the SPSA committed to the group, this group here, that they would provide guidance for the CERM officers, some direction and contact numbers for all the leaders, and he still hasn't done that. Marlo was in the meeting this morning that was privy to, but I heard from the comments prior to me getting on here that he was there. He committed to providing us the guidance documentation, the guidance documentation for the CERM officers on how we should be treated, how they should treat travelers going from medical or essential needs. That still hasn't come out. So, you know, I haven't had any trouble yet with producing a lot of trying to find the exemptions within the orders. Can do it. We don't know who's there. Yeah.